I'm Dr. Ruth Roberts, your pet's ally. I hope all is well for everyone. And lots of great questions today, so I'm going to just pop right over to the Facebook group. And Kathy, I'm sorry, Kathy, you're just not having a good time. So because Daisy had some liver enzyme issues in the past, I would go get them rechecked and see what's going on. And then also be cognizant that it may be something to do with her food, because I think you're in a position where you're not able to cook for a little bit, and stress, things of that nature. So I would definitely get her liver enzymes retested, Kathy. And Jamie's asking about poor Willie. He probably irritated his eyes and has some scabbed up spots to it. So the deal is, Jamie, that eyes can go from not very good to really awful in a hurry. So what I would suggest doing is, and I hate to say it, but put a cone on him, flush the eye out, use a warm compress to kind of clean it up a little bit. And if he's continuing to paw and paw at his face, I would go get him checked immediately. This is where you may be able to use saline solution to keep flushing the eye, and sometimes if you've got that those eye drops I talked about from Similasan, that can help kind of calm down the irritation as well. And I think those you can get at Walgreens or CVS, most of the chain drug stores. But if the eye itself looks irritated, it's really red around the whites of the eye, you definitely need to go sooner than later. And let's see, May, I think I answered this last week. There's a couple of different options out there. That's a lot of work and very expensive, these two products. So I would check out Wondercide, shoe tags, and we've talked about it a bunch of times, but those are both available on Amazon and all over the place. So check those out. And yeah, definitely don't use the Simpatica or Paraca or whatever it's called. It's lots of yucky stuff. Let's see, Sita's saying that Jesse's having some issues with his stomach gurgling when the belly band is on. And so there's a couple of things that could be going on. One is if he's standing up to urinate and then he's got this on, and I understand why you're using it because he's urinating like crazy. What may be happening is it is kind of pushing the guts up towards the chest, if you will, and so as he urinates, that creates space in the bladder, and then so stuff can move down. The other thing is that if he's not up and moving much at all, then simply getting up and taking a few steps are going to be enough to kind of help his gut feel a little bit better. So I hope that makes sense. And again, too, if his gut's just really whacked out, then that may be an issue, as Lolly says. But I think Jesse's been doing pretty well there. Let's see, Wendy's asking about a tick that was well attached but not engorged. And a bit of dry blood came off where it was attached. So, ticks can blow up and then disgorge, if you will, and then look like they were sort of normal ticks, Wendy, and that's my guess as to what happened. So the thing is that if you are in a high-risk area for Lyme disease, that's where you may want to consider talking with your veterinarian about either a homeopathic remedy for Lyme or even giving a single high dose of doxycycline. So they are really kind of freaky creatures, and if our pets have really thick hair, it's hard to see that they're attached and engorged sometimes. Yeah, and also I think the male ticks, let me think about that actually. I don't think the male ticks take too much of a blood meal, but that may have been it, and he made it and his life was over. May, hopefully Hannah was able to get you straightened out. If not, just email her and she will get you fixed up. And again, we wanted to get you sort of an early bird VIP sale because of the shipping issues that are evidently going to be a big issue, but we will be repeating this 25% off sale for Black Friday, Cyber Monday as well. And Wendy says Rudy is still having some soft stool and diarrhea, but no blood, but does have mucus. And this is, Wendy, what I would do is go to your vet and get a fecal test done, not just for worms, but because this has been an issue, I would look at a PCR test for other things like C. diff, Campylobacter, and make sure that these are not a problem. And this is where, you may have to start looking if, a fecal test and a PCR test for bacterial infection is normal, then this is where I think you have to start looking at what he's eating and what's going on. And, what I would do is wait on the supplements with the exception of probiotics, and I would look at Phytospor if you're not familiar with that, because I've been really impressed with how that's been working for pets. But I would look at adding in a probiotic and then getting things normal and back to a more balanced diet. And see how that goes. But I would definitely make sure that there's not some sort of a bacterial infection present that's creating these symptoms. Let's see. And Sri is asking about Cece all of a sudden having a urinary tract infection. And so Cece has had a multitude of issues with pneumonia, and hopefully those are resolved. But Sri, first thing is that if that has not helped, I would want you to make sure that a urine culture and sensitivity was done to make sure that things they're working. If there is a bacterial infection present, that the correct antibiotic was given. Cranberries are okay. The other thing that is super helpful for bladder infections is D-Mannose. And that is a sugar that seems to help kill both E. coli and Pseudomonas bacteria, which are very common causes of urinary tract infection. And it also seems to reduce inflammation in the bladder wall and prevent further issues. So I would, first make sure you get a culture and sensitivity, so the correct one is being treated if there is bacteria present. And then I would also, if this has not been done, get an ultrasound of the bladder done to make sure there's not something there that's potentially more sinister. So that's the questions for this week. Let me double check and make sure that I've gotten them all. And then Lolly's question about this big blood clot in Bogey's bladder. So that is really pretty strange, and if it looks like everything is clear, that's great, but that's a pretty intense bladder infection, and it may be that the white cells were in the center of this clot. But what I would consider doing is in about 2 weeks, I think you're going back, you said, let's see if everything cleared up since 9 days, and then you're getting a repeat bladder ultrasound on today, Monday, to make sure everything is clear. So I think that's a good idea. And then the other thing I would consider doing is a urinalysis in about 2 additional weeks to make sure this isn't something that's recurrent. That is very unusual, but we never say never anymore. It almost is like trauma, but it should not have responded to antibiotics. So my guess is that there was some pretty profound irritation of the bladder lining, and once the antibiotics got on board, any irritation stopped bleeding that may have been present secondary to the irritation. And I think that is it. I think Hannah messaged me. Yeah, oh good, about her dog. She sent me a very cute picture of her dog, Missy, who's a Belgian Malinois, and she all of a sudden had issues with her internet and went downstairs, and there's Missy looking at the plug and had pulled the power adapter out of the wall, so cut off the internet. Here's one other thing I wanted to share with you too. It really is, so we're in Mexico, as most of you know, and Mona unfortunately has fairly advanced kidney failure and is sort of failing more and more, or as they say in Texas, circling the drain. And I don't mean to be callous, but if you don't make some light of it, it gets really difficult. So, you know, we went to a veterinarian in La Paz, and really, really nice man, very well informed, very up to date. He had better equipment in my hospital than I did in my hospital in 2016. And, you know, just is doing an excellent job. And granted, La Paz is a relatively larger city of 250,000. But, you know, so we started on some sub-Q fluids because that's really helping her. And her phosphorus level, unfortunately, is to the point where we're having to reduce her protein intake, and even with Savelamar and all of that good stuff. But here's the interesting thing. So when I needed some thyroid medication, I just walked into the pharmacy and asked for the dose, and boom, they handed it to me. Well, same thing with the sub-Q fluid. So we called a local veterinarian here in Todos Santos, and they're like, "Oh, well, you just need to go to the pharmacy. We can give her fluids intravenously if you bring her to the hospital, but if you want to just do sub-Q fluids, go to the pharmacy." So we went there, and a bottle of fluids is 85 pesos, which is about $4. And I think the line was also about $4. So for $8, Mona has 5 days worth of fluids. And, you know, fluids are relatively inexpensive, and this was something that always just drove me insane in the U.S. I mean, bag of fluids would cost us maybe $2 by the case. Maybe, I think it went up to $4 after the shortages happened in 14 and 15. But golly, I tried not to gouge people, so we charge them $15 for the whole setup. But so many of my colleagues were charging, you know, $25, $35, $40 for a bag of fluids to give the client to administer at home. So go figure, I sure can't. But it was just really refreshing. People are working hard at helping each other out and helping pets out. That's what I have for you this week. If you've got questions, keep them coming. We'll see you next week. And until then, many thanks for your sticking with us and supporting us through all these years. Take good care.